The Philippines will let thousands of its healthcare workers, mostly nurses, take up jobs in Britain and Germany if the two countries agree to donate coronavirus vaccines, a senior official said on Tuesday. Britain's health ministry said it was not interested in such a deal and its priority was to use shots domestically, but added it would share surplus vaccine internationally in the future. The Philippines, which has among Asia's highest number of coronavirus cases, has relaxed a ban on deploying its healthcare workers overseas, but still limits the number of medical professionals leaving the country to 5,000 a year. Alice Vizpras, director of the Labor Ministry's International Affairs Bureau, said the Philippines was open to lifting the cap in exchange for vaccines from Britain and Germany, which it would use to inoculate outbound workers and hundreds of thousands of Filipino repatriates. Nurses are among the millions of Filipinos who work overseas, providing in excess of $30 billion a year in remittances vital to the country's economy. We are considering the request to lift the deployment cap, subject to agreement, Vizpras told Reuters. Britain has the world's fifth highest coronavirus death toll, while Germany has the 10th most infections globally. Britain said there were 11,000 more nurses working in the National Health Service, NHS, than last year. It said that while it was grateful to the 30,000 Filipinos working for the NHS, Britain did not need to trade vaccines for more. We have no plans for the UK to agree a vaccine deal with the Philippines linked to further recruitment of nurses, a health ministry spokeswoman said, citing Prime Minister Boris Johnson's pledge to share spare shots later in the year. We have confirmed that we will share any surplus vaccines in the future, for example through the COVAX International Procurement Pool. The Philippines wants to secure 148 million doses of vaccines altogether, while Britain has ordered more than 400 million doses, 6 times its population. While Britain and Germany have inoculated a combined 23 million people, the Philippines has yet to start its campaign to immunize 70 million adults, or 2/3 of its 108 million people. It expects its first vaccines this week, donated by China. Calls to Germany's mission in Manila went unanswered. In 2019, almost 17,000 Filipino nurses signed overseas work contracts, government data showed. While Filipino nurses have fought to lift the deployment ban to escape poor working conditions and low pay at home, the Workers for Vaccine plan has not gone down well with some medical workers. We are disgusted on how nurses and healthcare workers are being treated by the government as commodities or export products, Jocelyn Andimo, Secretary General of the Filipino Nurses United, Philippines offers nurses in exchange for vaccines from Britain. Some groups are urging the Department of Labor and Employment to send a nurse abroad in exchange for a coronavirus disease, COVID-19, vaccine. For the Filipino Nurses United group, it seems that nurses have become a barter chip, commodity in exchange for the vaccine. It is heartbreaking for many nurses, because they made us a chip. Although we see the intention and also the objective behind this act or intention, we still feel degraded nurses, said Leni Nolasco, Vice President of Filipino Nurses United. This is also the view of NAGCA's Labor Coalition Chairman Attorney Sonny Matua. First, our government restricts our nurses and medical workers to work abroad. Now our government wants to sell our nurses as commodities in a barter trade in exchange for vaccines. Even some lawmakers, such as Senator Joel Villanueva, opposed it. OFW deployment is not a barter trade. We simply do not swap people for products. Theirs is a knife-wielding move. If only the IATF had done their duty, the DOL would not have been forced to take action, Villanueva said. It will be recalled that on Tuesday, the DOL said it would allow thousands of healthcare workers to get jobs in Britain and Germany if the above-mentioned countries donate vaccines against COVID-19. It will take up to 3 million vaccines required by the government, which will be available to overseas Filipino workers. OFWs are in priority for in the country's vaccination program. If we will send our nurses, maybe it is better that they have been vaccinated. So maybe you might consider giving us, sharing some vaccines for, not only for our nurses but also for all our OFWs, said Labor Chief Silvestre Bello. Bello thinks it would be better if OFWs were vaccinated earlier against COVID-19. He also said he needs 15,000 Filipino nurses from Germany. The Department of Health did not know about the negotiations. We do not have any information about this yet. I think there will be a discussion and it should be referred to the IATF in case there are such plans or proposals that need to be made because of vaccines, said Health Undersecretary Maria Rosario Vergire. Bello, on the other hand, denied that he was just doing negotiation leverage with the nurses. I said, if they go there you will be worried because of the high COVID-19 cases in them. It would be better if before they went there they were vaccinated. Well, I mentioned to the president and there is nothing. He did not say don't beg like that, so his reaction is also very positive, said Bello. According to presidential spokesperson Harry Roque, President Rodrigo Duterte was not notified of the Dole's hearing. This is the idea of Secretary Bello and Secretary Locsin, which we also welcome wine because more is better than less. The president was not informed of this proposal. As far as I know, said Roque. According to Ambassador Daniel Bruce, the deployment of Filipinos in the United Kingdom and the assistance that the UK wants to provide for the Philippines to get the vaccine are different. We have two separate issues that are here. The first is the question of Filipino healthcare professionals working in the United Kingdom. Then there's the separate question of the work that the British government and the embassy and I personally very heavily engaged in, to support the Philippines in its efforts to secure access to vaccines, said Bruce. I'd say we've got no plans to link those two issues together, he added.